Late this summer, it's become apparent that an unusually large number of children are developing respiratory illnesses, and some of them have been severe. The Centers for Disease Control and Prevention has examined isolates from these children and has determined that it's a particular kind of enterovirus called Enterovirus D68, which is a previously known type of enterovirus, but one that's been uncommon. That's likely to be the cause in these children. The illness appears to affect children of various ages and often includes cough and difficulty breathing. Only a minority of children have actually had fever. Some children affected have had a history of asthma or a history of wheezing with colds in the past. Thankfully, only a minority of children have required intensive care. Enterovirus is a type of virus infection. It causes a spectrum of illness from mild to potentially severe, although the vast majority of children just have mild illness. It typically causes infection in the late summer and early fall. Parents need to monitor their children for respiratory symptoms, and if they have more than a minor illness, seek care, especially if their child is having difficulty breathing or has a history of asthma or chronic conditions that affect their lungs or heart. So there's no vaccine or antivirus medicine that specifically treats enterovirus infection, but we can provide what we call supportive care that helps children that are ill, and this can include oxygen, breathing treatments, and fluids if needed. To prevent infection, you should avoid contact with people who are ill, and if you or your child are ill, you should stay at home and avoid contact with other people until you feel better. As always, with any kind of a respiratory infection, it's important to cover your cough or sneeze with a tissue. And then also, as always, it's good to practice good hand washing. And that involves washing your hands after you've handled any tissues, after you've had contact with anybody who might be ill, after you've changed diapers or helped your child use the toilet, and after you've been in public places where you might be touching surfaces that are touched by other people. And then, of course, before you prepare food or eat food.